We recently went to, we visited Dr. Sileo, an orthopedic surgeon at St. Charles Hospital, so let's take a look at this package.
Most commonly here at St. Charles, we'll frequently see injuries to the shoulder or knee. They can run the spectrum from muscular injuries or injuries to the tendons, but frequently they can also involve injuries to the cartilage and or ligaments inside the knee and shoulder. That being said, we'll frequently see injuries to other joints or body parts as well. Injuries to the hip, to the ankle, to the elbow, or even the back are not uncommon in recreational or even higher level athletes. Here at St. Charles, we actually see a fair number of patients that really have many different types of injuries. Most commonly, we'll see patients with injuries to the rotator cuff or the cartilage about the shoulder. We'll see patients with inflammation of the cartilage inside the knee. In the case of Mariano Rivera, he actually tore his anterior cruciate ligament, which is a ligament inside the knee that helps prevent the tibia or shin bone from sliding on the femur bone. And it also, at least preliminarily, the reports are that he tore his meniscus, which is a little shock absorber inside the knee as well. I think to a certain extent accidents are called accidents for a reason, and sometimes they're not necessarily specifically preventable. That being said, there are circumstances where relatively minor aches or pains or relatively minor symptoms can sometimes be a sign of a more serious issue down the line if it's not appropriately tended to and treated in the early stages. I will tell you though that a feeling of swelling in a joint is rarely a normal thing. A feeling of catching or clicking, feeling of mechanical sensation inside any joint is rarely a normal phenomenon. You know, those kinds of things are truly something that should definitely be checked out earlier as opposed to later. One of the techniques that's currently used across many body parts is actually arthroscopy. What arthroscopy is, it's actually a procedure whereby a joint is typically filled with fluid, a liquid, and then we insert a small camera inside the joint, and with these techniques we're able to take care of a lot of injuries that in the past required much more extensive surgery, a longer rehab period, and frequently we're able to do them in a better way to allow athletes or even weekend warriors get back to the level of function that they want to sooner and with less downtime than before. Over time, as our techniques have gotten better, as our instrumentation has gotten better, and as our understanding of some of the problems that patients can get in the hip joint have evolved, we're actually able to take care of the hip joint now as well arthroscopically. But it's only been around for a few years. Really, there are only a handful of surgeons who are trained in some of these techniques. Now, here at St. Charles, as we've grown as an institution, we're now able to provide many of these diagnostic and therapeutic procedures. We're able to offer that to our patients out here as well. Stacy is a patient of mine who actually had been having quite a bit of trouble with her hip for many years actually, and she'd gotten to the point that she wasn't participating in activities that she wanted to do, not just recreationally but also with her family.
I was having a lot of hip and groin pain. Walking was an issue, running, just walking, driving, going up and down the stairs, and it was just too much.
Ultimately, we did do an arthroscopic procedure in her hip where we trimmed away some degenerative cartilage that had developed in her hip, and we also did what's called a microfracture procedure, which is where we try to get the body to form new cartilage inside the hip by stimulating the bone marrow. And after a relatively straightforward rehab process, she really did fantastic.
I had the surgery in August of 2010, and that was followed by about 4 to 6 months worth of physical therapy.
She was able to participate in many of the things that she had been avoiding for a long period of time as a result of her pain, and you know, most importantly, it finally got her back to the point that I think she was looking to get to prior to having the surgery.
My life today is completely different than 2 years ago. Walking is not an issue. I get to do a lot of the things that I couldn't do before: driving long distances, running. I've now started coaching my daughter's girls lacrosse team, which is a lot of running and never an issue, and I could just pretty much keep up with everybody now.